Jeff Chang, Joaquín Gaete-Silva, and Inés Sametband. Introduction.
Hello, my name is Jeff Chang, and I'm a registered psychologist and a marriage and family therapist, and do a lot of stuff with respect to supervising provisional psychologists in Alberta, and writing the supervision column and the supervision course for the Psychologists Association of Alberta. And I will be a professor at Athabasca University for another few months before I retire.
My name is Joaquín Gaete-Silva. I'm also a psychologist. I work at the Calgary Family Therapy Center. I work there as a family therapist, also as a clinical supervisor, and I'm also the director to the program. And I'll leave it there for now.
Hi, my name is Inés Sametband. I'm an associate professor with the Department of Psychology at Mount Royal University, and I'm also a marriage and family therapist.
So we were going to say a few words about what struck us the most about this chapter that we've put together. What was new for me was reflecting on how, in thinking about how we're trying to disrupt coloniality in our work, that the law and ethics, legal and ethical structures that exist around us are an outgrowth of colonialism. They are imported, through our status as a British colony, and really erased systems of law that Indigenous people in North America had for centuries. But the Western colonial approach was to say that we can take this unoccupied land that's occupied by lawless people, and we can just take it over. And that's really penetrated some of my subsequent work on law and ethics, writing an ethics course for Athabasca University. So that's kind of the new thing for me in writing this chapter.
Speaking of new, one thing that's been new for me related to the chapter, but first, at the Calgary Family Therapy Center where I work, I am a clinical supervisor. What it's relatively new for me is to supervise psychiatry residents. So I'm an adjunct to the Department of Psychiatry there, so that allows me to supervise residents. And what I've learned is that sometimes at the beginning of our supervisory relationship, it's a whole lot about reflecting on professional backgrounds to even understand how we're gonna benefit from this relationship. One way that I like starting that conversation is to ask them, well, why do they think people seek out for their services? Often that gets into a conversation about diagnosis and symptoms. And then I insist with my why question, but why would they? And my intention, I guess, is to bring forward an idea of pain. And why I'm saying this, because sometimes under the influence of those colonial discourses, sometimes I guess expressed in those diagnostic systems, things like our most life-related pains get dismembered, to use the language we're using in the chapter. So we have bits and pieces of pains in terms of symptoms, but it's hard sometimes with that language to really understand why people have pain about the things that they have pain about. And that's where inviting people to bring forth their own background understandings, and also the clients they serve, and my own, acquires like a new significance for us in order to really relevate the importance of background understanding and culture and practices to do everything in our work, including our relationship, supervisory relationship. I go back to not dismembering pain as a colonial practice that I keep resisting.
Thanks.
For me, and related to what you both are saying, I think that for me, what was really interesting about writing this chapter and also reflecting about is how the supervision space can become a space where the sort of ideas that come from the outside can be not only challenged but also reflected upon, right? Like in terms of sometimes it has to do with the law, sometimes it has to do with, professional discourses or other different discourses, and including in the supervision conversation questions about who are those discourses relevant to, or what are they relevant for, right? I think that looking at sort of like all of the cultural influences that are part of therapeutic conversations in general, it's very effective. But bringing those conversations into supervision and analyze further, sort of like as a third space where you can actually talk with, conversations between supervisor and supervisee about who is it relevant for, like, and what effect does that discourse, whichever that is, or this knowledge, what effect does that have for not only for clients but also for the relationship between therapist and client, and also the relationship between supervisor and supervisee. So rather than looking at explanations outside of the relationship, I think that one of the things that our chapter highlights is how we're thinking about the sort of like the relationship within, right? Like the relationship within the space of the therapy or of the supervision, and how those cultural discourses, backgrounds are influencing the relationship, and is that something that is preferred or not preferred, and is it useful or not for the people involved.
Cool.
Can I share a personal experience?
Of course.
So a few years ago, I did a practicum, and Jeff was my supervisor. That was like 2011.
11, 12, yeah.
And I was trying to remember that first meeting that we had, Jeff. And all that I remember from that first meeting is you being curious about, because I was coming from Chile, and I was already a psychologist back then. And I thought I was going to your office to get like an orientation about supervision, but all I got was you being interested in the ways that I would practice in therapy and down in Chile. That was a very nice experience of opening space for me to share and feeling that I was coming to this already with something that could be expanded, supplemented.
Well,
that's my first memory that I have.
No wonder we're writing a chapter together, because I was also a supervisee of Jeff, but when I was doing my doctoral internship. But before that, I was a student in one of Jeff's courses a long time ago. And although it wasn't supervision, but one of the assignments was to demonstrate therapy with a video. And Jeff's comment on my video was really interesting to me because it really pointed to the relationship. And so Jeff commented on the pace of my conversation with the client. I don't know if you remember this, Jeff, but
not a clue.
I even remember the client. But that was part of, I think, your supervisory style. And I think it's something that the three of us share is the focus on the relationship, right?
Yeah.
and also in really, as Joaquin was saying, sort of like integrating and allowing space for the person to develop, and for the knowledge that they already have, or supervisees that they already have, to be recognized.
Now, I was just trying to process what I just had said and what you were saying, Inés, in terms of with that same experience I was sharing with you. I guess I was under the influence of these colonial discourses around supervision, which is basically it's a system of vigilance. I guess I was living out the risk of being dismembered by that conversation.
Mm.
And I guess you being really curious about my ways down in Chile, I can see that as a way of remembering or opening space for me to remember myself, who I was, what I had, and what I wanted to do in this practicum. How did I wanted to expand my ways with your help and assistance and all the resources that you may have. So that's a good frame, I think.
So I'm having the sensation in this conversation of this being like a reflecting team. We're reflecting on the paper, on the chapter.
Mm.
And then I thought, what a dummy I am that I didn't put a section in the chapter about reflecting practices. So Sandra, when you see this, can you let me write another 3 or 4 paragraphs, please? And I've just really appreciated, knowing each of you over the years, and learning so much from you, and really, if I think about, oh my gosh, like Inez, that course was more than 20 years ago.
Yep.
I think I don't even feel like I knew what I was doing then. I was just kind of being pretty random, but doing what I could to create a space for people to, you and others, to access what they already know and already do.
Mm.
So I guess if there's one thing that characterizes how I think about this, it's that people are already doing a lot of what they know, that's already really effective, and can and should be built on.
Mm.
Yeah.
Yes.